we're excited to have Dr. Nickles returning. It's been forever.
It's been too long.
It's been too long. We have to run into each other at the mall now when we see him. He is with Nickles Dental, Oral Surgery and Family Dentistry. Been here for forever in Greenville. And today we want to talk about oral health and some holiday specials.
Absolutely.
So you sometimes don't think about holiday specials when it comes to the dental world.
We want to take care of everybody, so we're like Santa Claus. So you have Dr. St. Nick.
There you go. St. Nick.
You give a new teeth, you two front teeth for Christmas, right?
Won't judge. You always say that. If you've been putting it off, we won't judge. But
and we like those ads.
Yes, right?
And you know, that hits home.
It does.
You don't need to be judged and, you know, just go see you.
Well, you see it in the media all the time where people are always judging everyone, and so we want people to be able to come in and feel comfortable and get dental work done they need.
I love it. All right, so let's talk, because medical research is showing that oral health affects your overall health. We've heard before how it can mess with your heart and stuff.
It sure does. The oral bacteria, well, this is where everything goes in. So the oral bacteria that causes decay and gum disease gets into your bloodstream. And once it gets into your bloodstream, it travels throughout the whole heart. And they have shown that the oral bacteria is the #1 leading cause of cardiovascular disease. So we're talking about heart attacks, diabetes, and stroke.
You're kidding.
No.
That's crazy.
And so that's one of those things. If we've got to get ourselves heart healthy. We're actually working with physicians now. When some patients are coming in, we've been working with physicians, and we actually have been able to help some of our patients get their medications reduced by just getting their mouths,
that's amazing,
cleaned up, if you will.
And there's also a belief that teeth are dispensable. In other words,
absolutely.
pull it.
Well, that's one of those things.
We don't do that.
I got a toothache. They make a knee-jerk reaction, pull the tooth, it gets out, it's infected. But if you think about it, to me, your teeth are a part of your body.
Right.
And if your fingernail got infected, would you cut your finger off?
No.
So, and once you do that, you start losing teeth, you can't chew well, and that's the #1, place that we get all our nutrition, the ability to chew our food well and not eat processed food. So if we can chew our food well, if we get good nutrition in ourselves, we'll be a lot healthier. You start losing the teeth, it becomes a domino effect. One tooth actually causes the next tooth. They'll start,
I never thought of it that
so
way.
it goes and goes and goes.
So
and
you're trying to
one day,
save a tooth first. Last thing you want to do is
you want to save the tooth. Yeah, we go out and do a lot of treatment to people in nursing homes, especially people who can't get out.
Yeah.
The #1 thing you see in these people, they all have dentures. And you can't chew well, and they're eating, poorly nutritional food.
Things that are easier.
And there's nutritional value to them. I mean, they're existing and not living.
Well, let's talk too about missing teeth and how you kind of replace those.
Right.
Because you have all kind of things.
There's many ways to replace a missing tooth, but we believe the best way possible is a dental implant, because the dental implant is a root form, just like what you have naturally occurring. So if you can go back with that, that makes sense to put back in what you lost. Some people, they get bridges. Well, a bridge is actually grinding 2 adjacent teeth down, destroying 2 good adjacent teeth to put a bridge in. And some people go, well, I'm getting a permanent bridge. Well, they're not. The average lifetime of a bridge is about 10 to 15 years. And you have to have it replaced again, whereas the average life of an implant is a lifetime.
You can see right there, it's a fantastic diagram of kind of exactly what happens, what you're doing.
And one thing that will show is, if you have lost your teeth and you unfortunately do have dentures, we can actually stabilize that denture with implants today. And so that we can, you're not having to suffer through loose floppy dentures. We can actually stabilize them and help you start getting back to where you can eat better things.
But an implant's not going anywhere.
The implants are not going anywhere.
Of course, you match it up color-wise to your other teeth. How many years you been practicing?
27 years. I actually headed toward 28 very fast in the same location, yes.
That's amazing.
You were allowed to start when you were in middle school.
I was a young man.
Wasn't that so nice of them to let you start there? Do you have any great holiday specials going on
Actually, we do. We're doing $9.99 crowns, $9.99 implants, and full comprehensive exam and x-rays for $99.
Wow. Well, they need to just call that number right there.
Did you clear that with the lawyer sink?
Yeah.
Absolutely, we sure did.
Oh, yeah, all the nines, all the nines. All right, well, if you want to take advantage of any of those, call the number right there. And then as we go, does your office, do they do financing?
We sure do. We have third-party financing. If you need to, you want to get those low monthly payments in to get your smile you want, we have those available also.
There you go.
Wow.
Still located in the same place, Lake Forest. It used to be about the candy shop, right?
Yep. The chocolate shop.
The chocolate shop. That was perfect.
Pleasantburg, right across from BJU.
You know what? Thank you.
Thank
Don't
you.
be a
It's good to be
stranger
here.
so long.
Oh, sure.
We
We'll be
missed
back.
you. It was good
Thank
to
you.
have you.